Now to your community focus. We are joined once a month here on 12 News at 4 by Interim Department of Health Director Dr. Jim McDonald.
He joins us now live via Zoom. Doctor, thanks for being here.
Hey, Kim and Brian. Happy Thursday. Good to hang out with you again today.
Happy Thursday. So, Dr. McDonald, earlier this week we had Republican candidate for governor Ashley Kalus here in studio, and her company, Doctors Test Centers, is now in mediation with the state after the state decided not to renew their COVID testing contract. Can you shed any light on why that contract was not renewed?
You know, I'll just put it this way, Kim. You know, we really want the best service for the people of Rhode Island. We like the best testing. You know, the contract just came to a close. We had other vendors. We just went with other vendors. You know, one of the things I look at too for what I deal with contractors is, are we getting along okay? And sometimes it's just not a great fit. And I got to be honest with you, I think with Doctors Testing Center, it just wasn't the best fit for us. And, you know, it was one of those things where I just need to find what's best for the people of our state. And testing's important. I want people to get tested and feel good about their testing. And as a department, we need to feel good about it too.
Doctor, the Providence Journal reported there were numerous complaints about their testing sites. Is that accurate that you received? I believe the Journal said about 100 complaints.
Yeah, we had over 100 complaints, which is, it's a number, it's substantial. And I think, you know, one of the things I'm looking for is just like, I need the people of Rhode Island to feel comfortable with where they're getting their testing done, but I also want our staff to feel comfortable too. And a lot of it's just about what's a good fit and what's the best fit for everybody here. That's kind of where I landed on that.
Dr. McDonald, on current COVID trends right now, seeing a bit of an uptick in hospitalizations, that has always been kind of a key indicator for us. What does that trend tell us about the state of the virus here in Rhode Island?
Yeah, you know, it's funny. Omicron is the dominant strain in Rhode Island right now, but it's the subvariant BA2 that's really dominant here. It's more contagious. More people are getting infected. Our hospitalization numbers are going up, but I'm not worried it's going to be anything like we saw on Martin Luther King Day weekend. It's going to be like a little roller coaster, but it's more the kiddie ride than the thrill ride. You'll see these peaks and valleys as we go throughout the summer and throughout the rest of the year. You know, but it is going up. I think this is a reminder for people, if you haven't been up to date in your vaccine, you haven't got that booster, this is one time where it's like, yeah, I better get my booster vaccine. I better get that second dose if I'm eligible as well, like I did. Because I'm one of those older guys, and I want to make sure I took care of myself and my family. But it's something we're paying attention to. But there is treatment out there. I mean, one of the things I'll say is COVID's a treatable disease. And, you know, Paxlovid, it's something that's effective. It's working well. And so if people do get COVID, you've got to start the Paxlovid within 5 days. So ask your doctor about the oral medicine for COVID if you do get diagnosed with COVID. We've had education seminars for the doctors, so it's out there for you if you need it.
Knowing that the vaccine is out there, knowing there is the treatment you just mentioned, the CDC still recommends someone who tests positive stay home for 5 days when they don't have symptoms. Big impact, obviously, to the workforce when that happens. Any indication that that would change soon?
I don't think that's going to change anytime soon. You know, and this really gets to part of our culture. You know, one of the things about us as Americans is we work way too much. And my goodness, my friends, if you're sick, you can't stay home. There's something wrong with that equation. And I know people need paid time off to be sick, and they should have paid time off when they're sick. But quite frankly, if we're sick, we should be allowed to stay home and recover. It's important. And even if you don't have symptoms, we don't want to spread that to other people. So it's important to be able to stay home when they're sick.
I want to switch gears just a little bit. We've been reporting here on 12 News about an unusual uptick in cases of hepatitis in kids in various countries, including here in the States. Can you walk us through what parents should know and what we're seeing locally?
Yeah, so we're seeing nothing locally on this, just to be clear. About 25 states have seen cases, and it's a global phenomenon. And we're talking about around 200 cases on the planet, so it's rare. Hepatitis is not a mystery, though. So a parent should know is you should not worry if your kid has hepatitis. It's the type of thing you would bring your kid to the doctor if you saw this. If you see your kid in the morning with eyes that look yellow and the skin's turning yellow, parents will know to go to the doctor at that point. And hepatitis, almost always kids get better with that. So it's one of those things where it, you know, but we don't know what's causing it yet in the planet yet. So that's a mystery. And one of the things you see about where we are right now with public health is we do public health in real time. You get to watch this with us. And I think that's okay. But I think for parents right now, you know, nothing to be too concerned about right now. We're looking for it. We are definitely looking for it. And we have great doctors in the state who are looking for it too. But right now, no cases in Rhode Island.
That is certainly good news. And, you know, today was a beautiful day. We're getting into the season where we're going to be spending a lot more time outdoors. We heard recently about a fatal case of a tick-borne illness called Powassan out of Maine. I will admit I hadn't heard about this disease until last year. Is it common here in Rhode Island?
Extremely rare, extremely rare. It is a tick-borne disease, maybe one case every couple of years here, but extremely rare. But good reminder, let's wear insect repellent when you're outside. And I do want you outside, by the way. Please go outside, play with your kids, play with your loved ones, just go outside and play. Wear your sunscreen, by the way, too, because that's important as well here. But, let's get outside. Let's not let the ticks ruin our lives. Let's go out there and use our sunscreen, use our insect repellent. Let's go walk off those pandemic 15 pounds we all got.
Solid advice. All right, Dr. Jim McDonald, the interim director of the Rhode Island Department of Health, thank you so much, as always, for your time.
Thank you. Have a great day.